And so, to really help guide us in making these decisions, there are a number of guidelines that we're all familiar with that have been put forth by professional societies. I think most of us in the pathology world are most familiar with the CAP IASLC AMP guidelines, which is really the focus of the talk today. That's been largely endorsed by ASCO. But I'd also like to bring to your attention the NCCN guidelines, and we'll talk a little bit about them as well. And so the CAP IASLC AMP guidelines first came together in 2013 as a basically a joint effort by these professional societies looking at helping us understand when to test, what specimens to test, how to test, and what targets to test. This came out in June of 2013 and was updated 5 years later, came out in March of 2018. That really is the foundation of what we have been doing in the pathology laboratory. And in addition to giving us instructions on what to test and turnaround time that has been discussed in previous sessions, really the focus largely is on what to test. And so in 2013, we really only had EGFR and ALK to test. In 2018, ROS1 was added on as another biomarker. And that's really where things stand right now if we adhere to the most recent 2018 guidelines. But unfortunately, that's terribly outdated. The good news is that the third edition of the CAP IASLC AMP guidelines are in the works right now. The working group is being brought together and the guidelines are being revamped. And I have the pleasure of being on the advisory panel for this. And we have a target publication date of about 2023 for this new updated CAP guidelines. And so something as AP managers, you should always be well aware of what's coming down the pipeline and what will we be seeing. If you're not already attuned to the NCCN guidelines, so the National Consortium of Cancer Centers Network, it's 31 cancer centers in the United States that really have come together to also put forth guidelines on the management of multiple different diseases. And for the non-small cell lung cancer, we talk about in these guidelines the surgical approach, the oncology, the radiation therapy, diagnosis, as well as the pathologic management. And I bring this to your attention because since 2018, there have been 29 updates to the NCCN guidelines that have been published over that period of time. Again, really reflecting how up to date the NCCN guidelines are and the rapid pace of change that happens in this field. And so, in contrast to the 2018 CAP guidelines, where really they say the only three that you have to test are EGFR, ALK, and ROS1, at this point in time, the NCCN guidelines recommend at least testing for 9 targets: BRAF, MET exon 14 skipping mutations, RET, NTRK fusions, GRAF, the KRAS, the G12C, as well as PD-L1 status by immunohistochemistry. And then if you also include the pan-tumor biomarkers, including MSI status and tumor mutation burden, there really are up to 11 targets that need to be assayed. And so again, as AP lab managers, what do we do? How can we make systems to ensure that we have effective genotyping done for all of these non-small cell lung cancer specimens?